Hey everybody, welcome to the channel. Thanks for joining. I'm Dr. Sylvia. This is Askawayhealth, and today we're looking at pros and cons of the birth control pills when it's used, particularly when it's used in treating problems like heavy bleeding, heavy periods, or painful periods. So we're going to have a look at this today, but I'm so glad you're joining me. If you're watching live, please drop a comment, let me know where you're watching from, how your week's been, and any plans for the weekend. I'm just going to try and get my bits and pieces together. You guys know I love to share. I love to make sure that we've got either images or pictures and questions. So let me just make sure I've got them all lined up while we do that. So if you're watching this, please go ahead and share with somebody so they can join in. I would love to have people coming in to comment about their experience with the birth control pills. And I really have to, I think I should appreciate the person who's got this particular discussion started. You guys know that I usually like to talk about questions that have come into our channel. You know, people just pop in with questions and comments. And this particular stream has come on the back of something I saw on Twitter yesterday, which has really blown up. And I'm just going to show you what it is like at the moment. Give me a second while I open my Twitter on the screen, and I'm just going to show you how this particular topic has blown up and why I think it's good. It's worthwhile us talking or looking at it a little bit in more detail. Sometimes you can't say everything that you need to say properly in Twitter or on Twitter, given the number of characters, and I'm just not good at creating all these tweet threads. So maybe that's something I should think about doing. But seriously, I think it's an opportunity for us to discuss a little bit more about this. So let me share the tweet that got us off in this direction and bring you up to speed, and then we can look at different aspects of it once I've pulled it up. So it is, here it is. And so I saw this yesterday. Let me share my screen. Where are we now? Yeah, okay. So I saw this yesterday. Share. Let me check that you can see what I'm seeing. Good. Let me just make it a bit bigger so that you can also see properly. So hopefully, yeah, I've really maximized it, haven't I? Oh gosh. Let's see. Okay, so hopefully you can see this. So this is the thread that's triggered and prompted this discussion that we're going to be having today from this Twitter user at Hello Nicole. Says, unpopular opinion, but doctors prescribing young women birth control for period pain without diagnosing the root cause should be malpractice. When I happened upon this tweet yesterday afternoon, there were about 30,000 likes, I think. And it's obviously, you can see how it's blown up, over 90,000 likes. So there's a lot of interest in this topic. And we can appreciate that. I can appreciate that as a doctor. And I think it's interesting to go through the responses of different people, or the reactions of different people to this tweet, and I'm going to take some time to sort of go through a few that I've picked up. But yeah, if you want to follow the thread and follow the story, please go and have a look at this tweet. And of course, you can interact with it, share your thoughts. I love our channel and our live streams. I've developed it as a space that's dedicated to learning in a safe way. So no question is silly, no question is ridiculous. We're trying to learn and share experience, and that's what we aim to do. So if you have experience of this, or have a friend, a sister, a daughter, anyone, or it's your personal experience, whether good or bad, with using the birth control pill, please feel free to pop in and share with us. So this is the tweet. It's an unpopular opinion, she says. Well, given that it's garnered over 90,000 likes, I don't think we can say it's unpopular. But the issue is about doctors prescribing young women. When you look at that, it just went up from 90.3 to 90.4 thousand likes while we are watching. Anyway, so the issue is about doctors prescribing young women birth control for period pain without diagnosing the root cause. And should that be something that brings a doctor up for investigation or for malpractice. I mean, this user, from my understanding and just looking at it, looking at her background, is based in the United States. I'm a GP practicing, that's general practitioner practicing in the United Kingdom. But of course, you know that we talk a lot about birth control effects, the different types, issues, all about birth control on this channel. So this is something I think we should address, because I think we can learn a lot from the issue. So the first thing I wanted to talk about is challenging doctors' treatments. And let's look at this. We shouldn't be afraid to question this. I think it's completely appropriate for someone to ask this question and want to understand whether this process that doctors use, or this style that doctors use of starting a young woman on birth control for period pain without diagnosis. So let's put a little bit of background to this. And if you have your experience, please share with me in the comments, especially if you're watching on replay and you couldn't join us on the live. If you have your experience, please share with us. So the scenario is either, so there are 2 or 3 different possibilities. But first of all, let's look at a young girl, maybe 11 or 12, who's just started her periods. And that's what we call menarche. Menarche is the word we use to describe a young woman who's just started her periods. For many women, for many young girls, that time is when hormone levels they're fluctuating. That is, they're irregular. That's not because of any medical problem. It's simply because it is the beginning of this process. And so it's going to take some time for the hormone levels to settle down to a routine, and then produce periods that are regular. But what you find in some instances, not everyone, of course, but in some instances, what you find is girls who have periods that are irregular, so they may not come at the same time every month, or they may come with periods that are very heavy or painful. You may have heard of the term primary dysmenorrhea, which generally refers to the menstrual cramps that can come with periods when a young girl first starts having her menstrual cycles. Secondary dysmenorrhea, that is painful periods that I refer to as secondary dysmenorrhea, usually happen because of a problem in the reproductive organs. And this is when conditions like fibroids, endometriosis, polycystic ovarian syndrome, and so on can come into the mix. So it's quite good to be clear that a lot of the time, in a girl who is 11, 12, 13, a lot of the time it's likely that if she's having period pain, it's likely as a result of primary dysmenorrhea. Studies indicate to us that commonly, girls 11, 12, 13 do not have fibroids or polycystic ovarian syndrome or endometriosis. Commonly, we tend to find these in women who are older. And I say commonly because I'm not using a one brush paints everyone. That each of us is different. I'm not saying that you couldn't diagnose fibroids in younger people. It's different for us, for everybody, but you can have, on average, generally, in common or majority, what we find is that women who have painful periods and heavy periods, and when I say women, I mean young girls aged 11 or teenagers, may have this condition because of primary dysmenorrhea. And I am not saying that somebody who's 16 may not have fibroids. Okay, I would like us to put primary dysmenorrhea on the table. And the reason I'm saying that is because I want us to address the question, the challenge to doctors. Are doctors being lazy because they're not arranging any tests when a young girl is presented to them with heavy or painful periods? So the first scenario, I think, in this kind of setting, or the first scenario that relates to this issue that has been brought up by this tweet, is the possibility, okay, that what she's got is a young girl who's got primary dysmenorrhea. The second scenario is an older person, perhaps somebody who's 16 or 17, who has started her period some years ago and now has come with painful periods or heavy periods happening a couple of years down the line from when she first started. Now, that's different, okay? So that's different, and we need to look at that in a different way. And of course, you can have women in their 20s or early 30s. All this fit the category of young women. And for them starting with painful, heavy periods at this stage when they've had their periods when they were 11, they started their periods when they were 11 or 12, and now they had regular periods in the past and suddenly have developed abnormal periods. That's different. So there are different scenarios that cover this particular statement. I felt it was important to establish that. But when you come away from that and look at the question, why do doctors just start women in these categories or in any of these categories on the birth control pill without doing any tests? It depends on the scenario that you're describing. Okay, it is not generally that a woman or a girl comes to a doctor and complains of heavy bleeding or painful bleeding, and the end result is a birth control pill. That does not always happen. Okay, it is not generally, and I know there's been a huge response to that, and everybody has individual responses, but I think we need to make a balance. We need to ensure that this discussion is balanced, and that's why I think it's better to have a look at this in a video and not just use tweet responses to try and tackle this. But the useful thing is that it's created the discussion, so I'm really grateful for that. So I thought it was going to be useful, and I'm going to share my screen. I thought it was going to be useful for us to look at the evidence that we have. So let me stop sharing this particular screen, and I'm going to share another one, because what I want us to look at is the guidance, one of the guidance types that we use, or one of the policy documents, one of the ways that doctors approach a problem like heavy menstrual bleeding. So I'm just going to quickly check that you're seeing. Yes, so this is the screen I want us to see. I think it's big enough. So this is from the National Institute for Clinical Excellence, NICE, which is a public body that's sponsored by the United Kingdom government. Remember, I practice in the UK, so I'm going to be talking to you about what we use in the United Kingdom. So NICE is a public body. It provides national guidance and advice to you improve health and social care. Essentially provides advice on treatment or management of different conditions based on research, based on studies that it pulls together. Different individuals sort of sit down, collate this, and come up with recommendations. And these are used as guidance for doctors, both general practitioners and specialist doctors. So different consultant grades in different specialties to use in treating conditions. So we're looking particularly now at a woman with suspected menorrhagia, which is heavy bleeding, which is a term for heavy bleeding. And I want to just take 1 or 2 minutes just to take you through this, because this is what we doctors do. This is how we approach it. And by the way, I have also done a video on a doctor's approach to heavy menstrual bleeding. So if you're in that category, and I'm going to go through this very quickly, but if you suffer with heavy menstrual bleeding or have a sister or daughter who does, and you want to understand what it is that we're doing and have that kind of conversation with your doctor, and you want to understand what's the reason behind certain decisions, if you feel that you're not getting explanations, please have a look at that video. I think it will arm you with information that will be useful. But just looking at this guidance, so what we're expected to do, the doctor is supposed to take a detailed history, which is talking to you as a patient and trying to understand the nature of the bleeding, the impact on the woman's quality of life, her age, the first year when she had menarche, which I've just referred to. Then you want to know about her cervical smears, her cervical screening history. You want to know about her her normal menstrual cycle. Issues like a sexual history are important, including the type of contraception that she's using, if any, and thinking about pregnancy. Ask about medical history. So what other medical conditions she may have, a family history, drug history, related symptoms. Now, so I wanted to take you through this, because these are the things in your doctor's mind as you tell them that you're having problems with your periods. Now, of course, the kind of questions that we shall ask will vary depending on who is sitting in front of us. So if it's an 11 or 12-year-old girl, different from a 17 or 18-year-old, different from a 25 or 32-year-old person. But this is the guide that we have in terms of approaching this condition. And one thing I wanted to point your attention to, I'm just going to see if I can bring it up here. Okay, so we've looked at some of the questions, and we're also encouraged to look at if she's got heavy bleeding without other related symptoms. Okay, so this is if somebody just has heavy bleeding without other related symptoms, like bleeding in between the period, which is what you call intermenstrual bleeding, experiencing pelvic pain and or pressure symptoms, consider starting pharmacological treatment. This is important to note because this speaks directly to what this tweet is saying. And here we have national guidance. Listen to this. I'm going to read it out again. If the woman has a history of heavy bleeding, that's menorrhagia, without other related symptoms such as persistent intermenstrual bleeding, pelvic pain, and or pressure symptoms, consider starting pharmacological treatment without carrying out a physical examination. So that's saying, to some extent, that covers to some extent, and I'm not saying it is blanket law or a blanket rule. I'm just saying it's a guidance that if someone comes and doesn't have a pelvic pain, she doesn't have bleeding in between the periods, she doesn't have other symptoms that may suggest she's got fibroids or something else going on outside of primary dysmenorrhea, we can consider starting her on medication. And those medication are not just the pill. The pill is one of the options, true, but there are other possible options that could be used. So I just wanted to throw that out as one of the things that's in the back of a prescribing doctor's head as you're going through this story. And the other thing we look at, if a woman has a history of menorrhagia with other related symptoms, then you have to examine her. And when you're examining her, you're looking for signs of, has she got underactive thyroid, bleeding disorders, polycystic ovaries. So we are thinking about these problems. When we go through some of the tweet responses, it looks as if a woman just comes or a girl just comes, she's got heavy periods, and doctors ignore everything else and just, okay, fine, just take this to regularize your period. That's not right. And I'm not here saying that perhaps some doctors don't do that, but if they do, that's not correct. And we as doctors also need to say to ourselves, and we need to be honest to say to ourselves when we're not getting it right. But I will also say that generally doctors will not just put a young woman or girl on a birth control pill without considering whether this problem is as a result of primary dysmenorrhea, and because of her cycle has just begun, it might take a few months to settle down, and how that is different to somebody who maybe is in her 20s and may already have fibroids, who you then have to do some further tests. And the reason we work things out is by asking these questions, just like listed in this document, going through examination, and then, as it says, doing tests. So here we are on the part of investigation, doing tests as appropriate. Okay, so you want to do blood tests, for example, if you suspect a woman has fibroids, you also want to do this. If a woman's history, here's another point here, if the woman's history and or examination suggests a low risk of fibroids, uterine cavity abnormality, a histological abnormality, or adenomyosis, consider starting a pharmacological treatment for heavy bleeding without investigating the cause. Consider. So it's important that we put this in context. It's important that we look at, I always say this, I never ever put women in one big bag or bundle. We all have our own different experiences. How Lady A is going to experience the depot shot is clearly different from how Lady B is going to experience the depot shot, even though we can ascribe different things or different characters to the depot shot, but it can affect us differently. So each case should be individual. And I really empathize with people who've gone through so much difficulty, and I'm going to go through the tweets. So many different ladies have gone through such difficult times because of their birth control pill, because perhaps their symptoms were not properly reviewed. Okay, they now ended up with this problem. So what I'm trying to do is show you the guidance that doctors use. I'm just going to round up in this segment, and I just wanted to make sure that we are comfortable. This is the guidance that doctors use when we're looking at a condition like heavy menstrual bleeding, painful periods, heavy periods. We use such guidance to ask the questions, do the examination, and then consider, is this more likely to be primary dysmenorrhea, or is there something else underlying that then needs investigations? And then we work with a person to determine which is which. So that was the first thing I wanted to look at when you're challenging doctor's treatments. Number one, the doctor needs to go through a proper history, needs to consider an examination and consider tests before just beginning anyone on birth control pills, whether they're a 12-year-old or a 24-year-old or whichever category of young woman we're talking about here. Number two, if a doctor makes the decision with the patient, having explained to you that, well, given this, that, or the other, it seems it's likely to be this, should we consider using the pill? That's the way the discussion needs to go. And it's not just, okay, take this, go away, and that's the end of the story. And believe me, if you do and your doctor do agree that the way to go forward is by using the pill, then it's for a period of time that should be reviewed. It is not about putting somebody on the pill for years on end and then forgetting the story. No. Ideally, even in the young girl, remember that we said that we're waiting for the hormones to settle. That can happen within 3 to 6 months. So it may be that she only needs to have that for 3 to 6 months, and then she comes off the pill, and then we see, right, let's give it a few weeks, see what happens. And if your pattern has become normal, so you're having regular flow, it's not heavy, it's not painful, you're comfortable, you don't need to be on the pill. Okay, that's the approach that we have to what, that's what the doctor's aim is, and what it is in the in majority of cases, that's what it is. And I recognize, based on what I saw on the thread and what women were reporting, that is not always the experience, and that is painful, that is sad, and I know that there are some areas that we can do better. But I also want women to recognize that the pill used in this form can be of benefit for women who need to have it. And so let's come away from the idea that all doctors are just being, we're doing this the wrong thing. I've just shown you one bit of evidence for why it happens that way, and the considerations for it happening that way. So I'd love to hear from you. If you're joining, please let me know where you're joining from. How are you doing? What is the plan? What are you doing this weekend? Please don't be shy. We are talking about the pros and cons of using birth control pill in a young woman with heavy or painful periods. That's today's topic. So I've also addressed this a little bit, but let me just clarify. So the basis for using the birth control pills for young women with painful or heavy periods. So what I mean by this is there is evidence, there is a good evidence of the benefits of using the birth control pill. And I've mentioned why, because in a young lady, a young girl, she has irregular bleeding because her cycle is just starting. The hormones haven't had a chance to take a particular level. So they'll take some time to settle down, basically. They will settle down at some point. In most women, they will settle down. So she doesn't need to be on the pill for years. She can come off it after 3 months or 6 months to see if things have settled, and then she doesn't need to continue the pill for that method, for that reason of controlling the bleeding. Remember what the pill does, okay, is the hormones estrogen and progesterone in that combination, what they're doing is to reduce the heaviness of the bleeding, so they make the period lighter. And they can, because what they're doing is shutting off the natural hormones, what they're doing is just inducing the womb on a regular basis every month to shed some of its lining. That's the function of the pill. That's what it's doing, basically. It's allowing your regular hormones just to settle down. With time, they establish their own pattern. But what the bleeding that's happening month after month is the effect of those hormones on the womb. Okay, now, the other thing I want to talk about is when a woman, and one of the questions that's addressed is when a woman who has fibroids is given the pill, the birth control pill, the argument has been that the fibroids, for example, can be stimulated by estrogen, by the hormone estrogen, or even progesterone. There's some studies that suggest that the fibroids are responsive or receptive to these hormones. So the argument is, well, so why would a doctor give me this drug when they should know that it contributes to the growth of fibroids? And I've got a couple of tweets where people responded to that quite nicely. I'm going to share them in a minute. But we're talking about the basis for using the pill in these scenarios. And I've explained the basis for using the pill for somebody who's just starting her periods. It helps to lighten the bleed. It makes it regular, as long as you're quite confident that this is because of primary dysmenorrhea. Now, the issue about the effect of contraception on fibroids, and don't forget, fibroids are benign growths of the womb. I'm not going to go into too much detail about the definition of fibroids. Please have a look on my playlist. I do talk about, I've got so many different videos on the topic. So if you want to learn about that, please use that. But what fibroids do in the womb is that, of course, they will distort the womb. They affect the shape of the womb. They make it irregular. So many different changes to the womb. Now, one of two things. When you use progesterone and estrogen as contained in the pill, in the birth control pill, what you're trying to do is help somebody who's suffering from heavy, painful, irregular bleeding from their fibroids. So one of the things that the progesterone is doing is to make the womb lining thinner, reduce the thickness of the womb lining that is not stretched by the fibroid, and so help to reduce the bleeding. And the progesterone and estrogen are sort of combined in such a way that the estrogen is compensating for, or just covering the effect of estrogen. So that estrogen in the pill is unlikely to affect the fibroid because its actions should be opposed or covered by the progesterone. Now, this is still an area that is under research. We don't have enough studies that tell us clearly what the evidence is. I have looked at a recent study done in 2021, just published in 2021 in Finland, where the outcome in the study, and I will put the link in the description box so that you can have a look at that yourself and see what you think about that study. Well, the gist of that, I'm just pulling it up. The gist of the study, and in fact, I can share it with you if you just bear with me a second. And I'm just going to share my screen here. So it's called The Impact of Contraception on Uterine Fibroids. Let me just make sure that you can actually see what I'm seeing. Yeah, okay. So I'm just going to go to the page. I'm going to make it a bit bigger and just go back to the top. Okay. So this is, from the National Library of Medicine. This is a paper from 2021, Impact of Contraception on Uterine Fibroids. It's a long read. They looked at Caucasian women, both those on admission in hospital. Some had fibroids, some didn't. Some have used the pill, some haven't. And they sort of used questionnaires to assess these women. It's an interesting read. But just the summary of it, two things that were interesting that this study pointed out, right? That you have a number of different studies, okay? Some studies suggest that using contraceptives increases the chance of having fibroids. But then those studies looked at contraception using older women. It was difficult to sort of come to one clear answer. It was difficult to come to one clear direction of where this is going, because this study says, we have looked at this. Some studies say that some women who take contraceptives, they end up with fibroids. On the other hand, there's some studies that say actually taking contraception protects from fibroids. For example, they found, if you go all the way down and look at their conclusions, they said contraceptive use, that's using a birth control pill, decreases the probability of fibroids, especially among patients between 30 to 40 years of age. So I think it's really for those who are saying that, oh, they put me on the pill and it made me develop fibroids or made my fibroids worse. I am listening to you, I hear you, and I understand the concern. It is not the case all the time. It's not the case all the time. And I think what's also important is, what is the aim of your doctor when they say, well, let's consider putting you on the pill at this point if you have fibroid? It's not because we're trying to increase the size of the fibroid or make things worse for you, or that we don't know, because these things are usually for a trial period, for a period of time, not to stay on the pill endlessly for years and months. And I think it's really important to emphasize that it's women who are experiencing distressing problems with bleeding and so on. It's important to continue to bring this to the attention of your doctor for review. So I wanted us to look at this because I thought it was interesting. We're talking about the basis for using the birth control pills for young women with painful bleeding. I'm just going to check. If you're joining the stream, thank you for popping in. Please leave a comment. If you want to ask a question on this subject or share your experience, please drop a line in the comments as well for us to look at. Okay, so I think we've sort of trashed this particular matter on the basis for using the birth control pills. We've explained why it can be helpful in women who are just starting their periods, and why it can be useful for women with conditions like fibroids. There are treatment options for women who have fibroids or endometriosis or polycystic ovarian syndrome, where what you're trying to do is provide a regular bleed, less painful, less muscular cramps and all that, because this is what these hormones do in the body. And I've just addressed the point that somebody's saying that the pill caused their fibroids to get worse, because we know that estrogen is associated with fibroids growth. We have to look at it. It's a lot more complex than just assume. Just that statement is a lot more complex. There's a lot more to it than just that. And it may be that the certain receptors may be in some people may be responsive to estrogen. So it means that maybe some cells within the tissue of the womb may be responsive to estrogen, and some other people, they're not responsive to estrogen. So the response may differ. I've just shown you a study that indicates that using contraceptive reduces the risk of developing fibroids in some women. There are other studies that indicate that it can increase the growth of fibroids. So we still need a lot more research in this area. What is important is for doctors to be open with our patients, or provide information to our patients that they can use to make decisions and help them in making those decisions. So I think this is a good time to have a look at the responses on Twitter. So let me pull up some of the ones that I have. I'll see if I can actually just go straight into Twitter. So this is the one I was referring to earlier. Let me just quickly share this one with us. Let's see. So this one, I've just checked that you can see it with me. Yes, you can. Fantastic. Okay. So this one, so that's the lady who shared the initial tweet. Hello, Nicole. And this is somebody who responds and says, I was diagnosed with fibroids in 2015. And my doctor prescribed me some birth control pills to take for 6 months to try to reduce my bleeding. Those pills made it worse. I found out that hormones make the fibroids grow, so I was basically feeding them birth control pills, shaking my head. So this is that position I was just talking about now. And I understand. I understand. And I think probably a bit more communication between her and her doctor, perhaps. But the things I can quickly take away from this is she was given the pills for 6 months. So it wasn't end on end. It was for a short period of time, or for a period of time, after which we say, come back and let's see how you're getting, or let's see what effect, is this helping or not. And I would expect that if somebody takes this for 6 weeks or 2 months and it's worsening the bleeding, then we have to stop it. We're not going to continue for 6 months. But besides my talking, look at the response from somebody. Okay, this is a response from somebody. She says, that's why your doctor put you on a 6-month trial. She's put trial in capital letters. It's a trial. You got to figure out what works. My mom had severe fibroids with her pregnancy with me, and basically none with my brother. Some are estrogen sensitive, some aren't. Okay, now why have I shared that? It's because I just said it is not so straightforward as, well, estrogen makes fibroids grow. So if you start somebody on estrogen on the pill, you're going to make their fibroids grow bigger. Number one, there's evidence that in some women that doesn't happen. Okay, there is also evidence that suggests in some women it could. But this lady's explanation, for example, where she's saying that it may be that some people have fibroids and they're not estrogen receptor sensitive. The bottom line is that we do still need a lot of research in this area. That's number one. And secondly, it is about communication and explaining to people how this might happen. It was a trial. The doctor was checking to see what benefits could this lady have. That was what the doctor was interested in. They wanted to know, could this make a difference to this woman's symptoms? Because some people, the research doesn't tell us one way or the other. The evidence is open. We still need more study, so we can't say for certain what the outcome will be. And that's why it's a trial for a short period of time. So please, really important for us to take that on board. Okay, so let's look at some more thoughts from Twitter. I've pulled them out and I'm just going to bring it up here. So hopefully you can see my screen. Let me see if you can see my screen. Yeah. Okay. So let me just go back to. So this first one, well, we're familiar with this one. We've had a look at it. I think we've had a look at that one already. Okay. So what we're going to do is, what's the second one? Just going to make it a bit bigger so that you can see. Okay. So this is another response. I'm just going to check that you can see that. So and I'm going to take this away so that you can see the whole page. Sometimes they do it to ascertain whether you have endometriosis or not. If the pain stops, then they do that procedure where they explore your abdomen without having to cut you up. I know how they call it, to determine whether or not you have endometriosis or not. So this is sort of on the back of the one we've just looked at, someone trying to explain that sometimes it is a trial to check whether you're going to respond or check how you're going to respond. So it's not going to be long term, because sometimes you can't tell what the potential response could be. Some women find it of benefit, some women don't. I believe she's referring to having a procedure like a laparoscopy, where you have a camera that's put into the abdomen to explore for any signs of endometriosis. Another comment says, and this is responding to the original tweet. Remember the original tweet? It says, or doctors prescribing young women birth control without diagnosing the root cause should be malpractice. Okay, so this person is saying it really should be, because why was I on the pill at 12 or 13 years old for period pain? Over 10 years later, I still get those same horrific pains. They just give out things to minimize the effects of whatever it is, rather than discovering and treating the problem. So I hear this lady, and I know this is a valid concern, and that's why I wanted us to do this, so that we can share the experience and share understanding, or ask the questions. And I have explained that at 12 or 13, the initial consideration, because you look at things that happen commonly, a 12 or 13-year-old coming in with period pain, the first thing I'm going to be thinking about is primary dysmenorrhea. After listening to her story, after doing an examination, if that's necessary, after going through everything, is it primary dysmenorrhea, the most likely thing? Or could there be something else? Now, if we're talking about other things, if we're talking about having lots of facial hair, for example, if we're talking about a tummy that's she has a mass, or you can feel something on her tummy when you examine, you can feel a lump or mass on her tummy when you examine, or very large amounts of bleeding, that's unusual, or bleeding in between the period, that's unusual, then your mind as a doctor will be going in another direction and not thinking about primary dysmenorrhea. But if, given the history, the story that she's told, how long it's been going on for, and so on, if it's something that's closely related to just starting the pill, the doctor it's appropriate for the doctor to consider that this could be primary dysmenorrhea, and look at what options, including the pill, pain relievers, dietary advice, and so on, to manage the problem. And it should be for a short period of time. Come back after a couple of months, come back after 2 months, or if you're struggling with this method, come back so that we can look at things. It's not to go away with this particular method for 5 years or 10 years on end without a review. So I think it's important to say that while recognizing this lady's experience. And this other person says that's why it's taking people 20 years to get endometriosis and PCOS diagnosis. Very true. We have struggled with getting the right diagnosis because, sadly, many of us women, our symptoms are either disregarded, or this is down to something else, or you're exaggerating. That is really inappropriate. It's unfair to a person to treat complaints or symptoms like that. And I hope we're coming away from this situation where it's taking so long to make a diagnosis of endometriosis or PCOS. And so this is another person who says both are needed. So again, this is responding to the initial tweet, and says both are needed. So what she means by that is you need to do the tests, but you also need to have the birth control pill if somebody is struggling with painful periods. She goes on to say pain relief is an immediate step to improve quality of life, i.e. basic functionality. What doesn't always happen, but needs to, is an appropriate investigation of cause while maintaining quality of life on wait lists. Also, this is true for all chronic pain. Okay, so she is also, so we're trying to balance this out, and we're trying to look at this properly and not just use one, brush to paint across what all doctors are doing as being incorrect. I'll just grab a drink. Okay, and this is another response to the initial tweet. She says, this, put on the pill when I was 14 after passing out from cramps and heavy bleeds. Horrific periods my whole life, regardless of birth control. Cut to age 27, where a 10-centimeter fibroid is found in my uterus, explaining years of backache, pain, bloating, and low iron. That is painful. That is really painful. She says, get checked. Yes, get checked. That is really painful. I mean, if after 6 months, the birth control pill has not controlled this period, we should be asking ourselves questions. We should. Please ask for a second opinion. Please have a chat with another doctor, because she was 14 when this started. She now age 27, where she's diagnosed with fibroids. No, come on, that's not right. That's not right. Something in the history, something in the examination should have prompted this to be checked out a lot earlier than getting to age 27. Next, this is someone says, my doctor did this. So we're responding to the first tweet again. My doctor did this, that is, gave them birth control pill without any test. And when I told them it made my period pain worse 6 months later. So let's give her, let's establish that she did the right thing. Okay, so let's establish that she started it 6 months down the line. She came back and said, this is worse. They told me I didn't give it enough time to work and should keep using it. No, I don't agree with that. I totally do not agree with that, because what we have to be sensitive to is the quality of life of a woman. Yes, we know that women have different degrees of blood loss. You know, if you look at my video on heavy menstrual bleeding, one of the things I emphasize is that what is heavy bleeding for one person may not be heavy for another person. Even though we have a standard, we say, well, above 80 mils we characterize as heavy bleeding. But what is key is if it disrupts your life, if you're suffering from severe pain that's not tolerable, or that you get up and you're flooding, or you're all sorts of things messing up your life, then it is enough. It is a symptom that should be addressed, not endured. What else are you doing after 6 months? Come on. Yeah, 6 months is reasonable enough time for us to say, and listen, please, if you've started a birth control method, what we do recommend is if it is giving you troublesome symptoms that haven't settled within 3 to 6 months, an alternative should be considered. It should be changed. I don't know what we're waiting for more than 6 months to decide that this didn't work. So I have a problem with the doctor's comments. I'm not happy with that. Okay, so this person says, because an endometriosis diagnosis would have been way more helpful at 14 instead of 31. This person says, okay, she says, I was put on the pill when I was 15. Experienced weight gain, depression, mood swings, severe cramps, heavy bleeding, anemia. I tried a bunch of different pill brands. Nothing helped. Finally fought my way into getting opened up. And what do you know? Mama's got a tumor. Again, this is unacceptable. This is not a good experience. This is not, we didn't, when I say we, I'm talking about doctors looking at this. And of course, we don't know everything. We don't have all the information. I'm just going off on how many lines of a tweet. But this suggests that she had all these problems, and then she was going from one pill to the next, and it wasn't solving the problem. And eventually, she then had the tests. So I understand where this person is coming from and why this would be so upsetting to somebody. And the key thing is about if it's not been of any benefit after a few months, 3 to 6 months, come back and speak to your doctor. If they're not providing you the support that you feel you need, look for a second opinion. Because as you saw at the beginning, where I shared that guideline from NICE on how to manage heavy bleeding, there is room for starting treatment without doing tests, but it tells you the test. It's important to have the test because you're thinking about those conditions right from the beginning of the history. You're looking for signs of fibroid, you're looking for signs of endometriosis, you're looking for signs of polycystic ovarian syndrome. And if you're getting any of those things, or you're using the pill and it's not working, then we have to change tack. That's important. Okay, this is the response. I mean, I just picked it up because that was amusing. The person who shared the initial tweet posted a caption of some vitamin pills that she wanted to sell on the back of not using birth control pills. So you can question whether she's biased in this tweet that she presented. I'm not really bothered about that, although I think it would have been more appropriate not to push her vitamin pills. But I think what's important for me is the discussion that is created and genuinely wanting to address women's issues, address the ones that have issues with the birth control pill and then develop problems, and those who did use the birth control pills and got and had benefits from it. Okay, so this is another one, exclamation mark ×3. Like, there's so many issues that the person can have, and commonly endometriosis or PCOS, which isn't solved so easily. To be fair, even if endometriosis and PCOS are diagnosed, the birth control pill is one of the treatment options. Let's just say that. But I'm not saying that she shouldn't have the test to establish what it is if her symptoms indicate that. She says, personally, birth control helped all my symptoms, but it's not for everybody. Okay, good point. Let's acknowledge that. Might have provided her some help, but it's not for everybody. And this one says she agrees with the initial tweet. How you put a 13-year-old on pills, balancing her hormones. Don't be lazy. Do the tests. Get the right diagnosis and proper treatment for the different conditions. One size don't fit all. Another lady says, it took me 10 years and 4 doctors to get an actual diagnosis and treatment plan rather than just throwing birth control at my pain. And somebody else says, because it still just baffles me that they had me switching through all the birth controls for 10 plus years only to finally decide to go in and diagnose me with stage 3 endometriosis. And I'm like, I told you all something was seriously wrong. Okay, good to see the breadth, the width, how the different experiences people have. And the majority of people are coming back with this concern that there are underlying problems that we're not addressing. And I've talked about this. I've said it is true that there are underlying problems which should be addressed if you're taking a history, if you're doing examining the person, if you're reviewing them and not just leaving them for months on birth control pill as the solution. So yes, I will accept that if a doctor has done that without properly assessing, without taking time to ask, without bringing somebody back to check how you're getting on, without saying, let's consider another diagnosis, I will accept that is inappropriate. And I feel sad that somebody is having to go through this and after 10 years had developed endometriosis. And somebody says, now she says, I get this, but my life became 1,000 times easier once I was put on birth control. We should advocate for more research for sure. And I'm glad that I wanted to put a mixture because we're about balance here. We're not about to beat one opinion down or the other. We're looking at what's the fact, what's best, how can we best manage, how can we get better, how can we be better. And I want us to look at balance because, like it or not, there are some people who have these issues, like that other lady we just looked at who had stage 3 endometriosis after 10 years. Here is this lady who's saying, I understand, but my life became 1,000 times easier after my birth control. So some women do have an experience, somebody who's having really troublesome, heavy, painful periods because of primary dysmenorrhea can benefit from the pill, the birth control pill. And again, somebody who has some degree of endometriosis, maybe not as severe as stage 3, can benefit from using the pill. They're different ends, but let's understand what's going on and let's see where we can do better. Okay, here somebody else says, I've been on birth control from age 13 to 24 and I don't regret a single second of it. I don't bleed, I don't get cramps, and I've never had a pregnancy scare in my entire life. I remember how bad my period was, and I have no desire to experience that again. Malpractice for what? So you see, we're about balance, and I wanted you to look at both sides of the story. I think that's the last one. That's the last tweet I pulled up. Okay, so thank you if you're just popping into the stream. Today we've been talking about, I'm going to round up in a little bit. Today we've been talking about the birth control pill, and the reason we brought it up was, I'm just trying to see if I can share that because I just want to see if I can share the screen and get the original tweet back up again for us. Here it is. Here we go. So we're responding to this comment on Twitter. Unpopular opinion, guys, is a 91,000 likes. It was 90.3 when we started. So in the last 40 minutes that you and I have been talking, it has gone up by 1,000 likes. Twitter is amazing. So we're responding to this tweet: unpopular opinion, but doctors prescribing young women birth control for period pain without diagnosing the root cause should be malpractice. And what I've brought out to you today is that we need to look at this in a balanced way. And I'm not taking away the experience that women have had who have underlying gynecological problems that were not diagnosed when they first presented. I've put forward the argument that if you have a young girl who's 11 or 12, these conditions, these underlying medical gynecological problems are probably less likely to be present, and they're more likely to be experiencing what we call primary dysmenorrhea. And the treatment for that, it does include the use of birth control pills to help to manage heavy, painful bleeding. But I've also said that even if it's not a woman who has primary dysmenorrhea, it's important to take a proper history, to consider examination. I showed you the guideline from the National Institute of Clinical Excellence that guides what doctors, what we do, how we practice. And it provides us the guide in terms of what we should ask, how we should examine and test that we should do. And suggests that in some instances, you can start this treatment for a trial period, get the person back, and then say, right, if it's not working, let's do this, then let's do the test. So I wanted to share that balance. The other thing I've not mentioned is, and I want to throw it out there, and if you're watching on the replay or you're here, you want to comment this, I'd love to hear back from you. Assuming we are going to go ahead and do all these tests in young girls, for example, of 11 or 12, and I don't have anything against doing tests when they're necessary. I'm completely against leaving a woman to suffer 3 months, 6 months or more on a method. Her symptoms are not getting better and you're telling her to endure. She's not used it long enough. That's so unfair. That's wrong. But what I'm saying is, if you decide you want to do investigations, and the investigations are so many different things, with blood tests, you can do scans, for example, you can do camera tests to have a look into, to do laparoscopy, where you put a tube with a little camera at the tip to go in and have a look around at the womb, in the pelvis, at the ovary and all that, checking for endometriosis and, things like that. So there are different types. But for example, if we wanted to check somebody had endometriosis, and they needed to have a laparoscopy, have you considered that one, possible side effects of the condition of the test? Possible side effects which can include perforating an organ or causing excessive bleeding. Those are tests, and it's not just to scare us off doing the test. It's let us be real. Let's tell ourselves the truth, and why I should weigh the benefits and the risks. So if I have a young 13-year-old who has had heavy periods since she started her menarche, since her periods began, would I, before I start any treatment, say, right, let's go and do this test? I would have that chat with her and her mom or whoever's coming with her. I'll have that discussion. Let us be clear and put this on the table. And I also want you to be clear that if we do decide to go down the route of the pill, let's review it after this amount of time, because if it's not getting better, then we will have to go down the route of tests. So side effects. The second point is, what about if we go ahead and do those tests and somehow they don't manage to pick up that there's endometriosis? That is possible. We call it a sort of a false negative test. What that means is the condition is there, but the test didn't pick it up. What about that? So these are just a couple of instances or a couple of issues you want to consider around doing this test. If you want to put a blanket rule on do the test before you put on the birth control pill. So I am an advocate for discussion with a person. I'm an advocate of checking that it's appropriate to do the test. I'm also, I think you as a patient have to weigh in heavily on what we're doing to your body. And I think that if we doctors can do a lot better in supporting our patients and providing room, being more empathetic to how people like the experience people are having. That is what I'm getting from the 90 or 91,000 likes that particular tweet has got. I'm not selling anything. I just want a balanced view, and I want us to live healthier lives. And the other thing is, if I were going to put a 13 or 14-year-old girl through this whole gamut of tests and the anxiety it might cause, is that really the best way forward? And I want to put that out there because I would really love to hear back from you about this. And you're thinking about the test. Are you going to say to me, I don't care, just do the test and check that there is no fibroid, check that there is no endometriosis, check that there is no PCOS? Do the test first before you put somebody on the pill. And the other thing I didn't touch on, which I think I'm not sure we have time to go, that I really want us to stop before an hour, was using birth control pills and acne. Now that came up a lot. And this was, again, the upset people have that, oh, I go to see my doctor, I've got really bad acne, and instead of treating the acne properly, they just give me a birth control pill. Now, not all birth control pills, for that purpose, at least in the UK, we do have a birth control pill that your doctor, and it's not first line. Okay, perhaps I should actually do a video on this and make sure we gather all the information and explain it and go through the issues around it. But it's not first line. It's possibly for somebody who has acne that's not been responsive to basic treatments, number one, and somebody who also requires a contraception. So it's not first line for treating acne. It's maybe second or third. After that method hasn't worked, should we consider this method? And that's what our guidelines tell us. That's what we practice. So, guys, I'm going to end this here. It's been I love discussing this because I think that when we talk about these issues, it helps us do better as doctors. Our patients have better experiences. Please let me know what you think. Go ahead and have a look at that tweet thread started by Hello Nicole. See the thoughts going and tell us what your experiences are. Tell us what you think. There is a lot of my doctor didn't do this right, or they shouldn't have done this, which I take that on board. And I think a lot of issues arise in I'm trying to say lack of communication between both parties. And if that's addressed, then things would probably end up better. That's my take on it. But I would love to hear from you. Thank you so much if you've popped into the stream, for joining in. And if you're watching on replay, thank you so much. I appreciate you. Let me know what you think. Let me know what your thoughts are on this subject. I don't think we're anywhere near the end of this. And I think depending on the kind of interest I get, I'll probably do a couple of standalone videos on the subject to help enlighten us, particularly about painful periods. I know I've got something on heavy menstrual bleeding, a lot on fibroids. If you go and have a look on our fibroids playlist, I've got an endometriosis playlist. We look at different treatment options. And of course, you can send a question to our email health information service. We'll be happy to hear from you, happy to provide some guidance or information just to help you make the right decisions. And then, going forward, so that hopefully less and less and less of us ladies are stuck 10 years suffering until 10 years down the line, or 5 years down the line, or 3 years down the line, getting a diagnosis of some condition. That's really so disheartening to hear. But hopefully we've addressed this topic to some extent. I hope it's been useful. Please let me know in the comments below. Don't forget to like and subscribe. Where is my like and subscribe link? Yeah, there you go. Don't forget to like and subscribe. And I hope you stay well. Have a great weekend. And I will see you again soon. Bye-bye.